What is hand hygiene? Hand hygiene is a way of cleaning one's hands that substantially reduces potential pathogens, harmful microorganisms, on the hands. Hand hygiene is considered a primary measure for reducing the risk of transmitting infection among patients and healthcare personnel. Why practice hand hygiene? Cleaning your hands is one of the most important steps you can take to avoid spreading germs and getting sick. Proper hand hygiene is fundamental in both protecting patients and staff. When should I perform hand hygiene? Before and after caring for a patient, obtaining vital signs, glove use, handling an isolation patient, entering an exam room, going to a pod in the infusion suite, handling patient items, compounding medications, entering the pharmacy, and drawing up medications. During the pandemic, U.S. adults were more likely to remember to wash their hands after coughing, sneezing, or blowing their noses than in 2019. Despite the increase, about 1 out of every 4 people don't wash their hands after these actions. Always wash your hands after using the bathroom, before and after preparing or eating food, after coughing, sneezing, or blowing your nose. You should also wash your hands before and after touching your eyes, nose, or mouth, after going to a public place and touching a frequently touched surface, before and after touching your mask. Washing your hands is one of the most effective ways to prevent the spread of germs. Follow these 5 steps when washing your hands. Wet your hands with clean running water, turn off the tap, and apply soap. Lather your hands by rubbing them together with soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands under clean running water. Dry your hands using a clean towel or air dry them. When you can't use soap and water, use an alcohol-based sanitizer with at least 60% alcohol. Hand sanitizer is recommended for use by the CDC and can effectively kill germs carried on the hands. Follow these next steps when using hand sanitizer. Apply the product to the palm of one hand. Rub your hands together. Rub the product over all the surfaces of your hands and fingers for 20 seconds or until your hands are dry. When should you wear gloves? Gloves should be worn when there is anticipated contact with blood or other potentially infectious materials, mucous membranes, non-intact skin, potentially contaminated skin, or contaminated equipment. Important reminders: gloves are not a substitute for hand hygiene. Never wear the same pair of gloves in the care of more than one patient. Change gloves if gloves become damaged or gloves become visibly soiled. Donning gloves. Perform hand hygiene. Select the correct type and size of gloves. Extend gloves to cover the wrist. Doffing gloves. With the gloved hand, grasp the palm area of the other gloved hand and peel off the glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under the remaining glove, peel off and discard. And perform hand hygiene.